So this is Summer. She's a 25-year-old PGOA patient. She is in room 4. She's an induction for pre-E. Her PCR was 2.3, and they wanted to start MAG on her, so that was started at 3 a.m. And she's a G1. Her EDC was 622, which makes her 39-3. She's currently intact, no allergies. She received Tdap and flu, and she has 2 IVs in. She has an 18 gauge in her left forearm that currently has the MAG and the LR, and she also has an 18 gauge in her right wrist that's adapted and flush as well.
When are you assessing the MAG and how? And which reflexes? Any clonus?
Well, I have been doing my checks on the hour, and I've honestly just been checking the arm reflex. Yeah, I never really knew how to check the knee reflex accurately with her laying in the bed. But the patient's been feeling fine. She hasn't reported any symptoms or anything, and she feels fine. She looks like she's breathing okay, and I've listened to her breath sounds, every so often, and they've been clear.
What about clonus?
I honestly don't even know what clonus is, but I was just doing it the way my preceptor told me during orientation. And she never mentioned anything about the clonus.
Do you understand the importance of frequent assessment when a patient is on this medication? Do you understand this medication is considered high risk? This isn't just a normal healthy patient. She's very sick and is very high risk of seizures.
Oh. So this is Miss Summer. We're in room 4. She's a 25-year-old PGO patient. She's a G1. She's an induction for pre-E. Her PCR was 2.30. They wanted to start MAG on her, so that was started at approximately 3 a.m. And that was the bolus. And then we started the maintenance right after that. So she's currently on her third dose of the maintenance part of it. She's a G1. Her EDC was 622, which today makes her 39-3. She's intact, no allergies, and she has 2 IVs in. She has an 18 gauge in her left forearm that has the MAG and the LR, and the 18 gauge in her right wrist that's adapted off and it flushes well. So for her, I have been doing my checks on the hour, at the top of the hour, and I'm just assessing her every 1 to 2 hours for her breath sounds and her clonus and her reflexes and all that good stuff, just to make sure. Breath sounds are clear in all lobes, anterior and posterior. She has absent clonus. Reflexes are normal. I have checked the arm and the knees, and no changes. She's not having any symptoms of the MAG or anything. I stayed at her bedside throughout the bolus, and she was fine, no symptoms or anything. But yeah.
Okay, awesome. Thank you. That's very, very helpful. Great report.
Thank you.
Have you pulled the policy, Kristen, to make sure you're following it? It's been a while since you've taken care of a patient on magnesium, right?
It has been a while. It's been several months, but I haven't pulled it. Why do I need to do that again?
The policy is what we should be looking at very often. It's our handbook 101 about anything and everything. It tells us about a topic, medication, issue, what to look for, how to administer it.
Mm-hmm.
You may want to learn how to find policies and start using them as a reference. It's very helpful. It helps you understand a lot more and connect the dots. It's also based on evidence-based practice
Mm-hmm.
to make sure we're practicing the latest research. I look at it each time I have a patient that has something abnormal. It just helps me remind me and make sure I'm not missing anything.
Oh, okay. Well, that's good to know.
Kristen, have you pulled the policy to make sure you're following everything? I know it's been a while since you've taken care of a patient on magnesium.
Yes, it has been a couple months. I pulled it at the beginning of my shift just to kind of reference back to make sure I knew all the things to assess for and make sure I was caring for her the way I needed to. I honestly didn't realize how easy it is to have that just at hand. It has literally everything that I could need for my entire shift, just to assess her and make sure that she's not having any complications or even how to administer the medication. Like, I feel like everybody needs to take advantage and realize the importance of having the policy and referencing it. I think that I did print one copy just to have in the patient folder, but I think I'm going to print another copy just to kind of put with my work notebook, just so I would have it for quicker reference. And plus, MAG's super important and it's super high risk, so it'd be a lot quicker next time. But it definitely helps me connect the dots and like really understand why behind it.
Very good.
Yeah.
Very impressed. Very good.
Thank you.
You're welcome. Hey, Kristen, there's an A1 meeting, interest meeting coming up next week. Are you going to it?
Probably not. I honestly don't really have time for anything like that, and I don't really understand why the importance of doing that. Like, I'm just here to work. I work 3 days a week, and that's enough.
Hey, Kristen, there's an A1 interest meeting. Are you thinking of going?
Yes, I actually wanted to go. I've been looking forward to this meeting. I want to join it just to kind of help give me, access and resources to all that evidence-based practice and everything. I think that it's going to help me continue learning and building on that foundation, especially by having that in my back pocket. And I can go to all the meetings, and they even have conventions. You know that?
Really?
Yeah. And I'm not sure where the next one is, but I know it's coming up.
Okay.
But I think it'd be really good, especially me, being a newer nurse. I think it will help me for sure.
Are you interested in joining UPC?
I'm good. I really don't even know what that is or what they do or y'all do. I'm okay.
Kristen, are you interested in joining UPC?
Yes, I actually have been thinking about that for a long time. I definitely wanted to get involved more on the unit, and I think it would be good to kind of see the unit from a whole and kind of assess how things are going, good and bad with the unit, to kind of help improve on. I think it would be really beneficial, and of course making a difference in the work that we do every day and the process that we do. And it's good that we always relate back to that evidence-based practice and making sure that we're upholding those standards that we were hired to do. And I think it's an awesome opportunity to help provide change to our unit, because we're the ones who have to be in this environment all the time, and we need to be happy, so we can kind of have a shortcut to know,
Those are some really good points. It makes me want to join. You know when the next meeting is?
I think they meet, it's the last Monday of every single month, and it's in the conference room, and I believe it's at 5 p.m. So hopefully you can make it next time.
See you there.
All right, see you there.
Hey, Kristen, should we look up the policy on how to care for a patient on magnesium?
I took care of a patient in orientation that was on MAG, and my preceptor, she mentioned a few things that we needed to do and assess for, and even though it's been a couple months ago, I feel like I can remember it. It's fine. I'll just wing it. It's fine.
Kristen, what are you looking up policies for? We could just ask a charge nurse or another nurse, right?
Well, since I'm the one that's going to be taking care of this patient for this whole 12-hour shift, I feel like I definitely need to be on top of my game and know exactly what to assess for and kind of what I'm dealing with here. This policy literally gives me everything that I need to know. It tells me what to look for, how to administer the medication, signs for toxicity, literally everything that we need to know. Plus, if my patient ever had any questions, I would be able to reference this and give her an answer versus just coming up with some random answer that sounded good. But it kind of also helps me understand the why behind something that I may not be as familiar with. So I always pull up policies for something that I'm not as common with, or something I don't see every single day, just to kind of help keep me on top of my game.
Nurse, what is this medication for and what does it do?
So this is magnesium, and pretty much the only thing I can tell you about it is we give it to patients with pre-E, and it prevents seizures. But if you thought of any other questions, whenever the midwife or the doctor comes in, you can definitely ask them. But I mean, you look okay. You're alert and oriented, and you're breathing fine. And yeah, we give all of our patients this with pre-E.
Nurse, what is this medication and what does it do?
So this is magnesium. So since you came in with preeclampsia, which is what we call pre-E, you have an increased risk for seizures. This medication is going to help prevent those seizures. It is a very high-risk medication, so you will get this throughout your labor and delivery, and then 24 hours postpartum. We will be assessing you. You started this around 3 a.m., so you got your first bolus dose. So that it goes in super quick, and then now what you get is called a maintenance dose, and you'll get that throughout your labor and delivery, the postpartum times. We're going to be assessing you as we have been, or as you know, very frequently, just to make sure you have a continuous pulse ox on, so we can monitor your heart rate. As we were doing the reflexes earlier and your breath sounds, that's why I was always reassessing you every 1 to 2 hours, just to make sure. You can go into toxicity with this medication, since it's pretty serious. We just want to make sure that we're not heading down the wrong path there. We're also up here monitoring your contractions and baby's heart rate, just to make sure that they're doing okay with this medication as well. So your things like toxicity symptoms are going to be like respiratory depression, shortness of breath. You may have some lower blood pressure, or even like a change in like your status or your neurostatus or like level of consciousness kind of thing. So we want to make sure we stay away from that. But yeah, other than that, I wanted to show you this policy real quick. I pulled up just so you could read over, or if you had any questions at all. It's just kind of like some quick information about magnesium and what to expect and everything like that. So I'll just let you look. And this is the policy from our website.
Okay.
Do you have any questions so far about magnesium or anything?
Thank you for answering my questions.
Oh, of course. Yes,
I feel very informed.
Good.